primarily working with Parkinson's disease and movement disorder population, working in different capacity, right from the wellness care all the way to the comprehensive care, being an educator, being a coach. So combining all, collaborating, integrating new approaches is my approach. And I'm excited to talk to you today about all about exercise. So we'll be covering about science behind the Parkinson's care, understanding what specific is like Parkinson's specific exercises, finding new ways on assessing, tracking, and looking into how can you better collaborate, better integrate with different teams, with the care providers around you. So movement is exercise, right? Like you guys are everyone's very familiar that exercise plays an important role in just healthy living, in managing exercises. But how do we do it? There's ample of evidence out there stating about the importance of exercise, importance of physical activity. So today we'll just be diving into the literature, understanding the science, looking at it more broadly, finding new ways on how you can integrate the recent approaches, recent tools in your practice. So there's been a lot of research done on understanding the influence of physical activity and inactivity on Parkinson's disease. So based on the research done, one of the key benefits, one of the key highlights how exercise works as good as medicine is it helps you with improving your neuroprotective effects and promoting neuroplasticity. The neuroplasticity is one of the terms which is most commonly used when you talk about exercise. So it's a process where the brain gets reorganized and it makes structural and functional changes which can be induced by exercise, by the right amount of exercise. And exercise has a positive effect on overall your motor circuits, which helps you manage the motor symptoms. So basically, with the right dosage of exercise, there's some good changes happening around the regions of the brain, mainly specifically basal ganglia, which helps you release certain neurotropic factors, more like commonly quoted as fertilizers, along with increase in the dopamine release, dopamine connections, which helps you in turn having more of a neuroprotective effects, decreasing the stress, oxidative stress, improving function, and in turn, like delaying or slowing down the progression of disease and improving function. So that's all at the cellular, at the in like functional level. These are the changes happening. I just want to highlight and say, how does it work, right? We never get to like look into deep down. So that's the process of it. Just highlighting couple different ways, like topics of how exercise plays a role. So vigorous exercise releases certain neurotropic factors, brain commonly termed as brain-derived neurotropic factors, glial-derived neurotropic factors, which helps you improve your overall cognitive function, which helps you improve your helps act as a neuroprotection, which in turn improve the overall function, motor movements. So now, looking into the motor function, I'll just quickly run down like what all studies have been done and what does the study show. So this way we get to know like, okay, this is all the literature about the exercise. So looking into the effect of exercise on motor function, there have been a multitude studies done around this. So one of the studies which was done was around early stage Parkinson's disease. It included two groups. So the one group was assigned like stretching, resistance exercise, and lower intensity, and the other group was allocated more into higher intensity treadmill training program. The duration of the program was 3 times a week for 3 months for both the groups. They found that there was an overall improvement in walking speed, distance, along with improvement of their fitness, cardiovascular fitness in the treadmill training group, more in the higher intensity group versus in the lower intensity group. Similarly, there was a similar study done on cycling, looking into the effects of cycling for 3 months. There was an overall improved gait pattern in sedentary patients with Parkinson's disease. So here they used the forced exercise of the lower extremities during tandem cycling, resulted in improvement both in like fine motor and like global motor function. So overall improvement in their walking, their posture, and also in the fine motor task. The second study, more around the resistance training, and it was a long longitudinal study done for 2 years, 2 times per week. And the study's results showed improvement in the slowing, improvement in the bradykinesia, improvement in the motor scores, and general functional performance. The study also highlighted positive change in the cognitive function, meaning improved working memory and attention. And typically, like when you're looking into the cognitive function, it's recommended to add the dual task activities in your daily activities to make it more specific, more well versed, along with motor and cognitive training. Lastly, overall impact of exercise on quality of life. So among patients with Parkinson's, exercise is associated with an improved quality of life. So they have shown that a 24-week supervised treadmill training exercise had a positive effect on overall mood, depression, and functional. So those were the key studies done, highlighting the benefits of exercise on the motor symptoms, cognitive symptoms, quality of life. So that was like a quick rundown of what the literature is saying. Now, like, this is all great, right? Like we all know, you might have heard a couple other times, like this is all is happening. Now, where do we begin? What do you look into? What do you assess? What do you reassess? So that's what we're going to specifically talk and brainstorm and find new ideas together. So I'd like to ask you, I'll just start the poll here. So presently, what type of physical activity or exercise do you enjoy? Do you engage in? So is it more like aerobic exercises do you do? Do you do flexibility and balance exercise like yoga, tai chi, dance, strength training, functional training programs where you're combining movements like power moves or others? So you can select multiple choice. So I'll just like to know, like at present, what all activities you are doing. Okay. So aerobic is on the top right now. Okay. So as you see, like majority of you are actively engaging in aerobic exercises, followed by strength training and functional training. And then like 50, like a small percentage of you are also engaging in flexibility, balance exercise. So good, great. The next question is frequency of exercise. Like how often do you engage in exercises or physical activity on a weekly basis? Just like once or twice a week, 3 to 4 times, or more than 4 times? Wow, active group here. So everyone's like actively engaging in exercises. So I see like majority of you actively exercise at least 4 times a week, or somewhere around 3 to 4 times. So great. Now, one last question. So what what typically prevents you from exercising currently? If you're not able to keep up with the regular routine of exercising, what are your challenges? Is it fatigue, change in blood pressure, balance issue, weakness, lack of motivation, exercise support not there, or the choice one and just consider it as other? So primarily, like, motivation, lack of motivation, and fatigue is the primary concern. So I'll make sure we talk about it. We plan around different approaches around it to manage it. So great. So so this is a good start, like, understanding what you're doing, how you're dividing your week, understanding how long you're able to exercise, and looking into what are the barriers, what's preventing you from exercise. Is it just fatigue? Like, what's causing you fatigue? Are you doing the exercises end of the day? You don't have much time allocated for exercise. So looking, continuously assessing, reassessing is always needed, and that guides you next time, next week. So that's one piece. The other piece, what exercise is best, right? Like when you look out, like online community, in-person community, there are so many offerings when it comes to Parkinson's. Dance for Parkinson's, yoga for Parkinson's, walking, like name it, there are so many different variety. So when you're looking into this different variation, the key things which you want to look into is understanding, like Parkinson's is different for each of you, right? Like the presentation changes from person to person, time to time. So knowing, like, what's your primary concern, what's your symptom, what's bothering you, looking into your underlying health condition, like along with Parkinson's, do you experience any other, like, do you have any cardiovascular issue, or do you have anything uh, more related to joint pain? So looking into it when you're deciding or when you're planning to engage in a certain exercise program, understanding, like, okay, what's your like experience when it comes to exercise. Are you the one who really love to enjoy like any form of exercise, anything you enjoy it, or are you someone who likes to be more outdoors, you want to do anything outdoor, like walking, swimming, whatever it is, that's something which you enjoy, looking into it. Also looking into like your support system, like, environmental factors. Do you have a class around you, or are you more into the Zoom classes? Do you want to do something right in the morning, or so do you want to go more with the recorded Zoom classes, or more in person, like being a part of the group motivates you, helps you? So consider these different factors while you're selecting, while you're choosing the exercise class for you, and making sure you regularly follow it through, and make sure it, you're enjoying it. Like if it's dance, you're enjoying it. If it's strength training, whatever you decide, you're able to enjoy it, and you're varying it. Like you're not just doing one form throughout the week, you're combining different exercise classes, strength training, flexibility, walking, and making it more diverse, more multifaceted. So when it comes to Parkinson's specific exercise, there's a combination of exercises which you can do. So starting from strength training, so looking into the strength training more for your big muscles, more for your extensor muscles, like your back muscles, your leg muscles, your core muscles, that's what is needed. Typically doing it for 2 to 3 times a week, like 30 minutes each time is recommended. Followed by flexibility is more like yoga classes, qigong, tai chi, dance classes, more referred to as flexibility. So engaging in it 1 to 2 times a week, combining it with balance. Typically, it's good if you combine it with like combination of thing, more like functional movement activities. So if you're doing like combined movements, if you're doing strength training, you can have some component of balance, cognitive function. So combining, making it more challenging is the best way to plan your balance program. Aerobics is the best way to keep doing it regularly, like pole walking, treadmill walking, cycling, running, jogging, whatever is relevant, and gait training. Those are like wide range of combination which you can look into and see what suits you, what suits your schedule, how it works out. So this is one of the nice chart which is available online, and it's by Parkinson's Foundation. So typically the recommendation when it comes to aerobic is 3 days a week for at least 30 minutes, somewhere around moderate to vigorous intensity. When it comes to strength training, 2 to 3 times a week, around 30 minutes per session, followed by balance, agility, multitasking, more like 2 to 3 times per week. So this is just the broad range, just the recommendation, the generalized recommendation. So based on the recommended, like what we were talking, it's recommended like progressive muscle strengthening activities for at least 2 days a week for all major group, followed by moderate intensity for around 30 minutes or so every day. And that's recommended. If that's like too much, doing it regularly, then probably looking into vigorous intensity for at least 20 minutes per day, or like in all combining it for like 75 minutes each week. So that's the recommended for exercise recommendation. So now this is more generic. This is what the studies have found, like this is the recommended, but how do we make sure like you're using exercise as medicine, you have the right dosage, you have the right frequency, right duration, right combination? So this is something which you really want to talk to your coach, your Parkinson's coach, your therapist, your wellness coach, whoever you're working with, and understanding what type of exercise is needed for you right now to improve your symptoms. If you're experiencing balance as an issue, make sure you have a plan to address it. If you're seeing more of a muscle stiffness, more of tightness is an issue, make sure you have have a plan to address it. Similarly, looking into what's the right amount, how intense do you need to exercise, how often should you exercise, and the treatment time, like your exercise time. All these components needs to be well planned, needs to be designed while you're working with an expert in order to make sure you're using exercise as medicine, right? Like it's really important to get the right dosage, right frequency in order to get the maximum benefit of exercise. So one of the key components which I like to highlight is the aerobic exercise. Aerobic exercise is very common, and as you all mentioned that you guys engage in it. So while you're doing it, make sure you look into doing it into moderate and vigorous activity range. So how do you do it? So the talk test is one of the best way to assess it. If you're working to learn what's your intensity level. So if you're, for instance, if you're walking and you're able to keep up the conversation very easily, no difficulty, that means you're more into the light zone. It's very easy for you. If you're able to walk and it's a walk and talk, but it's difficult for you to continue the conversation, it's more of a moderate activity. But when it's really, really difficult for you to keep up the conversation, you're huffing and puffing, it's more in the extreme, more in the hard activity or maximum effort. So that's the way you can, see where in which zone are you working. And it's recommended for Parkinson's that you're at least somewhere around vigorous activity. But again, it depends right now, what's your current level? Where do you stand? If you're more exercising at light activity stage, then you want to gradually build your level up to the vigorous. So looking into it and seeing like how can you gradually advance it, how can you gradually challenge is recommended. So use the talk test to monitor it. If you have a heart rate monitor smartwatch, use that data to see how much you're exercising, how's your heart rate, how far you can go. That will be helpful. So that was all like a quick overview of how exercise should be designed. What are the components of exercise, looking into different zone like flexibility, balance, combined movements, aerobic exercise. So it's good. So the best, like when you're learning, when you're understanding, like there are so many different ways what you can do. So where do you begin? Like, how do you start? So the best way to start is to get a wellness assessment, more like a Parkinson's wellness assessment. And in the assessment, you get a score of your overall balance level, your fitness, like your aerobic capacity, your strength capacity, uh, your flexibility. You get a very you get a score, you get your baseline assessed using the standardized scores as compared to your peers. Followed by that, you do goal setting, understanding like what's your priority right now, what's your goal. If your goal is to walk this long, walk up the hill, walk down the hill, creating a plan to focus on the goals, and working on tracking and monitoring it over time is the best way to do it. And as you're as you're designing it, putting it in place, you also want to find ways on how you can connect with the community. You need to have like a buddy if you can exercise with. Even if you cannot do it in person, you can probably make sure you share your information, like, okay, I completed this many rings today, or if you're using a digital watch. So making sure you're well connected with your body or with the peers around you, and you're continuously encouraging each other, motivating each other to make sure uh, you you're doing together as a community, you're making it fun, and you're finding new ways to challenge and advance. So a quick overview of online like a wellness assessment, which I typically do, and see many individuals for this. So it's, you want to look into each component. You want to get the score for each endurance, like endurance, where do you stand, what's your endurance level, using different tests, looking into the strength, like your upper body strength, lower body strength, seeing how you can easily transfer, how many time you can transfer, and then using the data to compare it with your peers. uh, Balance test, using different ways, like balance just with one activity, with combined activity, looking into cognitive tasks and fine motor tasks. These are the key components which you want to get assessed and see your scores, and accordingly design a plan. So this is a typical like a sheet which you get when I work and do the wellness assessment. This is what I offer, just to have an understanding, like this is the scores, and comparing the scores with the age related norms. Lastly, creating a personalized exercise plan. It's really, really important, right? Like if knowing what's feasible for you, what works for you. So creating a plan for every week, making sure you're able to repeat it, making sure you're really enjoying it. You have a program, you have a plan, and it really sticks well. So that's important. So discussing, brainstorming on what ways can you make sure you have like a good plan for the week, you're doing it well, you're enjoying it, is also necessary. And lastly, assessing and tracking is important, because that's when you know how much you're doing, how was your week, what's not working, what do you need to change. So as simple as using like an exercise tracker, you'll just like pen and paper, put it down daily. How long did you walk? How was it? How easy was it? How hard was it? That can be a way. Put down like what all component of exercise did you engage in. If you're doing strength training, did you do upper body, lower body? Put that down. Depends, how do you feel about it. If you feel like, okay, you're okay documenting or tracking, great. Then as specific as you can be, perfect. If you just want to do more like tick mark, then this is something which you can do. If not, just use the smartwatch, just track how many steps did you take, how long did you walk, couple different components you can use for tracking, and that will really guide you. Like the days when you didn't do well, you can use like, what was the reason, is there any change around, do you need help, do you need to talk to someone. So that can be a guiding factor, and you can easily communicate with your team if you need any support, any help. Lastly, this is all great information, but if you're someone like, okay, it's really difficult for you to exercise, and you're like, okay, this is way too much for me, I'm not ready for this, the best thing I'll suggest is looking into exercise snacks. meaning, just doing small bouts of exercise. So as easy as, like, just doing sit to stand right before lunch, right before breakfast, doing it 10 times, 12 times, as many times as you can, walking around, like walking around your, like a block, or whatever's, feasible, looking into some stretching, like just putting 10 minutes, 12 minutes in the morning, in the afternoon, in the evening, or just prior to the breakfast, prior to lunch, and see how you can find new ways to move. Put the music on, probably just doing some simple tapping, and see how it goes, and gradually you can challenge yourself with new ways to move. So all in all, the biggest highlight, the biggest factor which you need to consider, it's you need to look into the range of different exercises. It's not just one form of exercise. It's not just, just walking or just tai chi. You want to combine it all. You want to find ways how you can put all of it together and make sure you're enjoying it. Make sure you have a program, you have a buddy to work with, you have a coach. So putting that in action is really important. While you're doing it, also making sure you're doing it at the right frequency, at the right intensity, and it's personalized. You need to get a personalized approach on designing the program. Like, if you're someone who's looking more for endurance training, and making sure you have a plan of addressing your symptoms, addressing your condition, and it's very, very personalized to you. And you need to constantly find new ways on how you can challenge your current level of function. If you're able to do 30 minutes very easily, we need to find something new which really challenges you, which really targets your aerobic capacity and helps you advance further. So that's the big takeaway. Like, there's not just one form of exercise, just do this. So look into wide range of option and see what fits for your day-to-day schedule, and plan it out. Work with your team, work with your body, and make sure do it every day, do it regularly, and enjoy it while you're doing it.